Thank you, Colin. It's an honour to be here. I really admire the work the Centre does, and to sharing a platform with you, Sir Colin, is genuinely. I've got used to speaking at events where I'm the person in the room that knows the least about the topic. This is another one, I'm afraid. Even on things like fairness, I realise after listening to Monique, my depth of thinking about some of the issues of fairness is probably not as deep as it should be. I've always thought that I equated fairness with pornography, in that you may not, as a law lord once said, you may not be able to define it, but you know what it is when you see it. I do feel that my approach to equity is one which is really that simplistic. We may not be able to define what is fair between people, but when we see it, know what it is. And I'm going to try and be a bit more sophisticated about that in the future, Monique. So thank you for your guidance. And I do appreciate the opportunity to discuss this vital question of health equity, particularly for Pacific people. I've got a particular interest in this from my experience with Te Whatuora. I've got a particular interest from my role as Chancellor at what Damon Saleza instructed me to call Aotearoa's largest tertiary educator for health professionals, which indeed we are. I hasten to say I'm not talking on behalf of AUT here, these are personal views, but mostly just as a person living in Tāmaki Makaurau, where Pacific people make up such a significant proportion of the population in every sense. I'm not going to go into and rehearse the many inequities in health outcomes for Pacifica peoples living in Aotearoa, nor am I going to focus on the importance of these people and the inequities they experience numerically, economically or socially, not only in Aotearoa but across Moana Nui a Kiwa. These are all well known. They are not hidden. And it's all the more shameful for the fact that they are well known, not hidden. Sometimes, you know, simple repetition of deficits numbs the senses. It acclimatises us to injustices, blinds us to solutions. We develop, and I told Monique I was going to use this phrase, we developed a learned helplessness which hold us back from seeing what we should be doing simply by repeating the facts again and again that are well known. Instead, what I want to do is to not have yet another analysis of the many things which are wrong, which reflect deficits or failures, or the incremental funding, training and service delivery adjustments which flow from that sort of approach, no matter how grudging and inadequate they may be. We simply will not solve these issues of equity by tinkering with the system or tweaking its processes. So in my contribution today, I want to turn that approach, the traditional approach to discussion of health inequities, on its head. I think we've got our whole approach to health so wrong that a complete reversal of our thinking and action on health is required, particularly when it comes to the inequities facing Pacifica people in this country. What if we took an approach which started from the actual people in the actual location we're in and asked ourselves, what would a healthy approach to health look like? I do this with particular reference to Pacific peoples, putting them at the centre, appropriate when you're in a whale after all. But I do say from the start that the implications of this to me are vastly positive for all the other peoples that are here as well. First, we should stop thinking about a health system as being about New Zealand. That colonial state nomenclature itself carries with it too much implication of hierarchy, injustice, and cultural blindness. We will not find our way to a healthy health system from that state. We will end up with a copy of other imperial or colonial states which all display exactly the same inevitable injustices to Indigenous people or migrant people or low-income people. Maybe let's just be frank and call them brown people. Populations around the world. It is frankly ridiculous when you reflect on it to expect that any healthy health system for the many populations in this place could be created from the vision, tools and practices of such a state. It was never designed for such a purposes. What we call the state of New Zealand was never designed to deliver justice to Pacific peoples. No one ever thought it was. Why would we expect that it does today? It doesn't make any sense. It will not even be enough, to substitute a name such as Aotearoa as our place. I think it's preferable because it does, through Te Tiriti, include the Indigenous peoples and their ways in some way. But again, we know the differences between various hapu and iwi, between Te Ika o Maui and Te Waiponamu, are real, as are the real differences between the many migrant and other tauiwi populations in this place. These cannot be brushed aside or obscured into an homogenous form to suit colonial administration practice without great harm to the health of the existing health system. We don't live in Europe. I'm going to say some pretty obvious things here. We don't live in Europe. And we are not islands to ourselves. The most natural and healthy way to locate how we think of ourselves, to me, is as part of Oceania. Once we do that, think about it, once we do that, once we say where we are located is not in this state called New Zealand, which we're located in a place called Oceania, immediately Pacific peoples, their health and the health of their islands are not something external, but an integral part of what, where, and how we live. Not a minority, not an addition or a marginal group, but an intrinsic part of the whole. Even the centre of the whole, if you consider the geography and history of this vast continent of water and islands holistically. You can see immediately why it makes no sense to have a health system that somehow Pacific people are marginalised or external to or prevented from. Can't get to a healthy health system that way. And it tells you immediately that the health of the whenua of our many islands, all part of that same great ocean, and the health of the peoples of those islands are intrinsically linked to each other across the great ocean. And you can import as many palangi and their laws and practices as you like. That will bring many positive and many challenging things, but you will not change that crucial fact about Oceania. It is the underlying fact of all of our health. So we must start with recognising the essentiality of health as being about the health of our place, our whenua, our moana, our awa. Start to imagine a health system which placed that at its core. It's very hard to work back from our current state to such a healthy space. So hard that we can really only imagine working forward from such a state and must prioritise it, not treat it as an optional extra, which might result from greater material extraction, production and private wealth, but very likely won't. Our natural resources as part of this Oceania are a treasure, a tauranga, which is part of our being, not something to be bought and sold, extracted and exported, but a living being of which we are part. A healthy health system starts there, doesn't start at all. When we proceed from health at that foundational level, we can readily see that the next level of health is about how we live. Healthy nutrition and hydration, healthy homes and clothing, healthy work and play. It makes no sense to expect or encourage human health after taking no steps to protect and nurture it. View health services like a repair shop at a demolition derby. The way we treat it now. So that second step of healthy people, a healthy health service, is the provision, promotion and protection of healthy people living healthy lives. Sounds kind of something like a public health system. Is the second essential foundation, not as an optional extra, but using the knowledge we have about health rather than ignoring it until something goes wrong. What a radical idea if you look back from where we are now. It's simply logical, practical, if you look at it from the right base. From this standpoint of healthy public health systems, we would then, I think, surely recognise that when health is nevertheless threatened by accident, genetics, age or some other causes, age is prominent in most of you, we must recognise and respond to that and do so in the most accessible place and process that there is, that we can find. Sounds like prioritising primary care as the third foundation of health. Not as a good or service to be bought and sold in a private market, but as a genuine public service, available to all, based on health need, not capacity to pay. Not as an optional extra, as I keep saying, but as a right, a part of the foundation of a healthy health system. We would prioritise universal availability of what health services were needed as an essential part of life, not as a cost centre, one to be minimised, rather an opportunity to maximise our health as communities in Oceania. Now we know, being realists in this world, I'm imagining and not free market dreamers, that we will still wish to have hospital level care, procedures and technologies in this world, though it will be for many fewer people than we currently need, given that we've approached the foundational aspects of our health system in the right way. We would not need to and would not dream of, in a healthy world, treating this as a luxury. See it as a service which flowed naturally from our healthy communities and was something we shared with pride and aroha, not simply as a cost centre grudgingly provided. The only envy involved would be the envy of those who had not built their health system on the healthy foundations that we have. We have, by taking this approach, inverted how we think and act about health. This is exactly the inverse of our current health system. We've eliminated many of the myriad obstacles to equity and health outcomes. We will have, in fact, built distributive justice into our health service system. Now, the fact that we don't have this now is the result of directly thinking about it in an irrational way. We have an ill health system, a system which favours treatment over protection and promotion of health, which treats health services as a commodity and its provision as a transaction. On this view, health is not about scarce resources and their allocation, which was my economics training. Not about scarce resources and their allocation to how we repair unhealthy lives in an unhealthy environment. Everything we do now, health services, feeds those ideas. How do we deal with ill health in an unhealthy environment? And it's obvious that increasingly private provision will seem like the answer, the inevitable outcome of this, because we have structured it around a service delivery which is a transaction, and who's better at doing transactions than private providers? The ideology says that private markets most efficiently allocate scarce resources across competing demands. No more reason to expect equity from a health system built on that ideology than there is from any other market. Why we need to invert it. Now, we know that inequity abounds in the current health system. We know that Pacific people are amongst those most disadvantaged. In this beautiful city, we live in the governments, not just the current government, which purport to represent us, neither genuinely recognise nor seek to combat this inequity and others like it. 1 in 4 babies born in Tamaki, Pacific, deserve a healthy health system. Get it, we've got to turn the priorities on their head. Unfortunately, I've got no expectations either the current or any of the most likely alternative combinations will embrace such a radical shift. Recognition of how much this shift is necessary to achieve a healthy health service system will develop slowly, and it will develop from the bottom up, from communities adversely affected by the current approach, not from the health bureaucracy and others. We have to recognise who benefit from the current approach. Too often forget that while we may think of health services as being too poorly resourced and with many staff paid too little, that is by no means the full truth of our health service system. The dominant story of our health services is one of wealth accumulation. Pharmacy, medical devices, health properties, and even service deliveries, where private equity increasingly sees and takes many opportunities. Much more the reality of our health service than the poor parts of it that we see. They won't let go easily. So the future is in the hands of those who are fighting to go back to the start, who are fighting for the health of our whenua, moana and awa, who are fighting for economic and political power to be exercised by marginalised communities that are not marginal, such as Pacific peoples, here and throughout Oceania, fighting to establish health services grounded in their own communities. The real shame of the Paora legislation, which underpinned Te Whārawara, was not its aims of health equity, but its failure to adequately recognise that the foundations described in this talk today as the primary drivers of community health and its naive reliance on the institutions of the old system to deliver the new. Never. Ngāka Whaiora was a tentative step in the right direction. So were the iwi Māori partnership boards. Potential to exercise mana motohaki and health services was glimpsed, briefly then taken away. Pacific People's Health was never given the same recognition and independence, didn't even really get the glimpse. It should have been, but the mean arithmetic of the balance sheet, ballot box, overcame the logic and heart of who we really are, where we live, and what our potentials are. We are treated as workers and consumers in a make-believe world where dollars mean more than ourselves. Apart from some occasional nods to diversity, nods which are increasingly being truncated or withdrawn, we're subject to what the Reverend Professor Pulu Vai described in a talanora I was with this past week as oneification, another good word. Quantification, that is, everything, no matter how diverse they are, must dissolve into one reality. He said it denies people their difference and cultural integrity by maintaining the legitimacy of only one story, one language, one culture, one way, and one frame of reference. He opposed this to the specific approach of relationality and of a VAR which embodied both unity and connection and contradiction. Reality which might be complex, but is more in accord with reality than the fantasy that everything can be treated as a dollar. This does not really work for anything much. It certainly doesn't work for a healthy health system. The Reverend Professor has seen that, at least for some forms of activity, such as education. People in the Pacific must create their own islands of practice wherever they are in the vast ocean, stand on the cultural values they have inherited from their tupuna, and see a vital application of that to health services too. So to conclude, it's no use asking the institutions of the old world, the colonial, the dollarised, homogenised world, to lead or make the changes we need. That work, that right, that historical obligation rests on those experiencing inequity. Bob Marley put it, none but ourselves can free our minds.